12 differences between bursitis and tendonitis explained in full detail, organized heading by heading for maximum clarity. Number 1, structure affected. Bursitis. Bursitis is the inflammation of a bursa, which is a small, fluid-filled sac that cushions and reduces friction between bones, tendons, and muscles near a joint. Tendonitis. Tendonitis is the inflammation of a tendon, a tough connective tissue that attaches muscle to bone and transmits mechanical force to create movement. Number 2, primary cause, bursitis. Mainly caused by prolonged pressure, direct trauma, e.g. a fall, repeated friction, or sometimes infection, septic bursitis. Tendonitis. Usually caused by repetitive strain, overuse, sudden increase in activity, or improper technique that overloads the tendon fibers. Number 3, type of pain. Bursitis pain is typically diffuse, constant, and aching and becomes worse when the inflamed bursa is compressed. Example, leaning on the elbow in olecranon bursitis. Tendonitis. Pain tends to be sharp, localized, and activity-related, worsening during tendon movement or muscle contraction. 4, onset of symptoms. Bursitis can develop suddenly after a direct blow or prolonged pressure, e.g., kneeling for long periods causing prepatellar bursitis. Tendonitis usually has a gradual onset, developing slowly due to repetitive microtrauma over days or weeks. Number 5, swelling characteristics. Bursitis. Swelling is often visible, soft, and bulging, sometimes forming a distinct lump over the bursa. Tendonitis. Swelling is usually less obvious and may appear as a slight thickening along the tendon rather than a fluid-filled sac. Number 6, location of tenderness. Bursitis tenderness occurs directly over the bursa, often at a specific point where pressure is applied. Tendonitis. Tenderness is felt along the tendon's path, especially where the tendon inserts into the bone. Number 7, aggravating factors. Bursitis pain increases with external pressure, lying on the side, hip bursitis, resting on elbows, olecranon bursitis. Tendonitis pain increases with movement, particularly resisted muscle contraction or stretching of the affected tendon. Warmth, redness, and inflammation signs. Bursitis more likely to show redness, warmth, and visible inflammation, especially if the bursa is superficial or infected. Tendonitis. Redness and warmth are less common. Inflammation is mostly internal along the tendon fibers. Number 9, common locations. Bursitis. Common sites include shoulder, subacromial bursa, elbow, olecranon bursa, hip, trochanteric bursa, knee, prepatellar bursa, heel, retrocalcaneal bursa. Tendonitis. Common sites include rotator cuff tendons, Achilles tendon, patellar tendon, wrist extensor or flexor tendons, biceps tendon. Associated sounds or sensations. Bursitis. Rarely causes sounds, the bursa does not typically move in a way that produces noise. Tendonitis may cause crepitus, grating, crackling sensation when the inflamed tendon rubs during movement. Number 11, effect on mobility. Bursitis may limit movement due to pain on compression, but full range of motion is often still possible unless swelling is severe. Tendonitis. Limits specific movements involving the tendon. ROM may be restricted, particularly during active motion, not passive. Number 12, treatment focus. Bursitis treatment focuses on reducing pressure and friction, ice, rest, anti-inflammatories, padding or cushions, aspiration if severe or infected, avoiding aggravating positions. Tendonitis. Treatment focuses on controlled loading exercises, stretching and strengthening, rest from repetitive strain, physical therapy, gradual return to activity. Healing often requires rehabilitation rather than only rest. If you want a comparison, thank you. Have a wonderful day.